Distinguished ladies and gentlemen, representatives of African member states, regional economic communities, UN agencies and other international organizations, distinguished experts, representatives of civil society organizations, ladies and gentlemen, it is actually an honor to welcome you to this webinar, which is actually looking at the issues of COVID-19 as the impact on wildlife or the wildlife economy. We are actually at a time when COVID-19 has had an impact and continue to impact on various sectors, on communities, on nations, as well as cities in various ways. We are aware that, for example, some of the economies or most of the economies have been affected due to the impact of COVID, and at the same time, livelihood opportunities have shrunk. And of course, there are a number of statistics, and already now the number of cases stand at 4.8 million globally. And in Africa, of course, we are also not spared. And given the fact that our health systems are not that robust, and the fact that most of our people actually depend on natural resources, including wildlife, for their survival, that actually puts even more pressure in terms of opportunities, or as well as measures that communities are supposed to take to be able to cope with the pandemic and their day-to-day life. So based on that, actually, it's why Traffic together with AUC have decided to come up with this webinar to be able to provide a platform where experts, as well as the people who are operating within the the wildlife landscape, could be able to share views in terms of the real impact of COVID-19, as well as what measures or policy options could actually be explored to be able to move forward. And without wasting much time, I would like just to highlight the fact that we need to be able to stick to the time that is allocated to us. And of course, the webinar itself will be recorded in terms of content so that that can be made available at a later stage. And without much ado, allow me to introduce the panel of experts and offer them the floor. And after that, we'll be able to actually entertain questions. First of all, we have got Mr. Steve Broad, who is the Executive Director of Traffic. And in addition to that, we have got Dr. Nick Nwab, who is the Director of AU PANVAC. We also have Dr. Scott Newman, who is a Senior Animal Health and Production Officer from FAO. And finally, but not least, of course, we have got Ms. Leah Wanamba-Nessus, the Policy Officer at the African Union Commission. So I would like at this stage to invite Steve to be able to give his perspective on the subject at hand.
Thank you very much to our moderator, Hassan, and on behalf of Traffic as a co-organizer of this webinar, thanks to all of you who have joined us today. By way of introduction, Traffic's a leading non-governmental organization working globally on trade in wild animals and plants in the context of both biodiversity conservation and sustainable development. So we're wildlife trade specialists. Traffic's been collaborating actively with the African Union Commission since about 2015 in the development, promotion, and implementation of the African strategy on combating illegal exploitation and the illegal trade of wild fauna and flora in Africa. And in doing so, we've worked closely with the Commission in the context of CITES, CBD, as well as the Forum on China-Africa Cooperation, FOCAC. Today's event is obviously one very specific aspect, dealing with one very specific aspect of the current global pandemic crisis that's affecting health, livelihoods, and the future outlook for so many people around the world. Our focus today is on the role of wildlife trade in the emergence of zoonotic diseases, so diseases that emerge from animals, wild or domesticated, cross over to people and become diseases that are passed between people. And also how the risk of this threat might be better managed in future. So my role is to give some background to that and then look forward to hearing the other speakers. So why is wildlife trade an important factor to consider in this context? Well, here are some key issues. Firstly, there are strong indications of wild animal source and link to a market location in China where wild animals are sold for consumption for the disease that we're dealing with now, COVID-19. That said, it's not proven 100% at this time. So is this concern warranted? It is warranted because there's strong evidence of similar wild animal, domesticated animal, human spillover pathways from a range of disease emergence pathways from the past. I'm not going to go through a list, but you will have seen referred to in media and other articles, and there's some good research papers around this about these linkages from a range of diseases over time. And this is not a new concern, it's a concern that's been expressed by specialists in that field. But even if this specific case of COVID-19 is not proven as having this wildlife trade, wild animal pathway, there's no doubt that just the extent of the pandemic we're dealing with now is reframing risk management. And management of zoonotic disease emergence is one of these classic low probability, high impact problems. It's like planning for the occurrence of a tsunami or an extreme weather event. If it happens, it's going to have a massive impact. But the chance of it happening on one particular day or through one particular event is relatively small. So irrespective of the specific source now, the impact is very clear, the impact of zoonotic disease. And there's clearly a big agenda for doing something about it. So why is wildlife trade a threat in the first place? Firstly, wildlife trade, and when I think about wildlife trade in traffic, I think about the trade in wild animals, plants, fisheries, timber, non-timber forest products. But a lot of the particular concern here is about the movement of wild animals, and particularly live specimens and unprocessed products from wild animals. A movement of live animals in trade and animal products in trade tends to involve mixing in trade between species, in trade points, consolidation points, in transport points, and in markets. Wild animals mix with other species, mix with domesticated animals, and of course coming into contact with people who may be keeping them, who may be working in those markets, or may be involved in consuming meat and other products. Also, often animals in a trade chain are under stress, and stress is a major factor in terms of disease transmission. And these pathways, they could be legal or illegal. It really doesn't matter in terms of the risk at the top level, because many of the cases we've seen in the past of zoonotic disease emergence from wildlife trade actually do come from legal wildlife markets and legal wildlife keeping in farms. Illegal trade does bring additional risks because of risks, the fact that illegal trade is avoiding health controls, quarantine, inspection, and the trade out of sight brings additional risks. But this is not just about illegal trade. So what is being done now to try and get a grip on this particular aspect of the pandemic? First is to understand the risk. And we certainly, and I know others, have been reaching out to specialists, including some of the types of people who will be joining us on this meeting today, specialists who understand zoonotic disease risk, who can start to frame where those risks apply. Is it about particular species in trade? Is it about practices or places like markets? Also, to try and think how wildlife trade speciality at the moment crosses over to this issue of dealing with disease risk. Most wildlife trade laws in most countries and at an international level are designed to address overexploitation and conservation risks for good reason. Seldom are those laws integrate at the moment with laws that relate to animal health or public health. And that's a major challenge in terms of coming up with solutions for the future. Next thing is to understand wider impacts on trade and wildlife products, including the full range I referred to at the beginning, including wild plants. We're seeing shifts in use patterns. We're seeing increase in use of some wild plants being recommended as medicinal treatments or tonics to increase the immune system. These could create new impacts from overexploitation, and we need to look at the sustainability of that. And also, increasingly now, we're beginning to look at what can countries do individually and collectively to address this risk. So thinking about that response framework, we'd recommend a range of approaches. So firstly, really trying to understand risks, reaching out to specialists in the zoonotic disease field to understand what are the aspects of trade that are linked to zoonotic disease, the local trade, what aspects of wildlife trade are happening in any country. There are local markets, there are international markets. If there are export markets, then there will be consolidation, there will be export locations, there will be particular ports of exit, there will be particular types of companies involved, like shipping companies and airlines. So what is the landscape for managing risk? Let's think within that, in terms of understanding risk, there are the questions of what are the particular species of concern, are the particular places like marketplaces or transport hubs, and are the particular practices which are causing more stress to animals and increasing risk. And is the particular places where there are exposure between particularly wild animal trade and where domesticated animals are in trade. So really trying to map that risk as part of the response framework. And then understanding options. What are the current animal and public health regimes, and how do those mesh or not mesh with wildlife trade controls at the moment, which again are mostly conservation related. And just looking at this in terms of responding to some country requests at the moment from traffic, we're certainly finding it's really important to look at an integrated approach that looks at public health, animal health, and conservation in a combined approach, and starts to look at where are the connections between the different types of response being brought through sectors which are often not talking to each other as much as they could do. So there's a range of solutions that I hope we may pick up on more on this call. Overall, I'd say there's a new focus on human health risks linked to wildlife trade practices. It's certainly warranted as a component of the wider thought on action on the relationship between people and nature as this COVID-19 epidemic persists. There's a lot we can look at in terms of current trends and just understanding the risks around what is happening now. But there's also a lot of important work to do in terms of predicting the future. What will be the impacts on conservation and including the wildlife trade impacts of the impacts that we will see from changes in economy, changes in livelihood, loss of tourism revenue, and a whole range of other factors. Change in the way transport works, the change in accessibility, and just the overall impact on different sectors. It's really important to understand this and begin to try and start forecasting this in terms of future impacts and future responses. Responses need to be targeted, appropriate to the task, and really design needs to be grounded in experience gained from past wildlife trade interventions. We know some things that have worked, but we also know some of the factors that undermine wildlife trade interventions, whether they're designed for conservation or to protect health. Those are things like the factors that lead to illicit trade, that lead to illegal trade practices, that attract crime, and also the fact that often wildlife trade controls are undermined by corruption. In the same way that human and environmental health are intimately connected, it's essential that new health-focused wildlife trade interventions, if they are to be developed, are considered in concert with those already focused on conservation gain. And let's not forget that the main focus on wildlife trade in the policy context over the past 10 years in particular has been around the threat of overexploitation, the threat of illegal trade, the attraction of organized crime into that business. Those problems have not completely gone away by any means. So here we're talking about a new agenda around the health-related risks, but an agenda that needs to be integrated into the current concerns if we're going to have meaningful solutions moving forward. So those are my introductory comments on the issue and where wildlife trade comes into this issue. Thanks again for joining us, and I look forward to hearing from the other speakers today and joining the discussion. Thank you.
Thank you, Steve, for your contribution. You have highlighted quite pertinent issues that are related to, of course, the fact that we need to be able to forecast or to predict what is likely to happen in future in terms of these risks that are associated with the transmission of diseases between wildlife as well as humans. But you have also underscored the fact that even though the risk may appear to be low, normally the impact is quite devastating. And on top of that, of course, you cautioned us about the importance of taking measures, especially as we start exploiting or exploring possibilities of using plants as one of the means for boosting immune systems, as that also, of course, puts those plants at risk in terms of their sustainability. But I think the most important thing is the fact that we need to bring in issues of human health, animal health, environmental health, and all these other forms of health, bring them together or take them into consideration as we approach a solution towards some of the problems that may be related to COVID-19. On this note, allow me to invite Nick to be able to give his interventions.
Good afternoon, all. My name is Nick Mwamba, the Director of African Union Pan-African Veterinary Vaccine Center. We are involved in the certification of veterinary vaccines on the African continent, and this involves vaccines either produced or imported into the country, into the continent. Now, I will focus more on discussions. I'll focus more on zoonosis. I will talk about understanding risk factors and how these risk factors are involved in zoonosis and the evolutionary process involving disease outbreak occurrence, and how this impacts control measures. This is especially related to the COVID-19, and also I will touch a little on wildlife, trade in wildlife. Now, the 21st century has seen the emergence of many high-profile diseases: SARS, MERS, H5N1, H1N1, and now COVID-19. These are truly high-sounding diseases. Most of these diseases are zoonotic, and as Steve mentioned, it means these diseases emerge from animals, crossed over the species barrier to infect humans, from where it spread. And in the case of COVID-19, now causing devastation. Now, are these information about zoonosis new to us? Certainly no. Approximately 65% of all human infectious diseases and about 75% of emerging infectious diseases that have affected humans in the past several years have originated from animals. Most of these diseases cause large numbers of deaths with huge social and economic impact. Now, what is even more interesting is that scientific research has identified hotspots, which means areas more likely to experience the emergence of new diseases. And we also know of precipitating factors for the emergence of these diseases, that is, factors enabling infectious diseases to evolve into new ecological niches in animals, breach the divide, and adapt into new hosts. In the case of COVID-19, humans, from where it spreads. Now, COVID-19, as we know, is a group of, it's a disease born from a group of coronavirus. Certainly, these viruses are not new to us. Scientists have known about human coronaviruses since the early 60s, even though wider recognition grew over the past few years. Permit me to mention a few of these coronaviruses. In 2003, we had the SARS outbreak, which was caused by the severe acute respiratory syndrome virus, SARS-CoV virus, the coronavirus. And this outbreak occurred in mainland China and Hong Kong. In 2012, we have the MERS coronavirus, which is the Middle East respiratory syndrome, and it happened in Saudi Arabia and the United Arab Emirates. And of course, we are witnesses to the recent COVID-19 in Wuhan, which has affected over 9 million people with a mortality rate of over 130,000, causing the most unprecedented public health emergency in history. Now, but it is surprising that we had advisories about coronaviruses long before now. For example, in May 2003, the World Assembly of the WHO, in its resolution of May 27th, recognized SARS, that is severe acute respiratory syndrome, as the first severe infectious disease to emerge in the 21st century, which poses a serious threat to the stability and growth of economies and the livelihood of human populations. So, with these advisories, why were we not prepared for COVID-19? Why was the world caught unawares? The simple reason being, we did the same thing. We did the same thing we did with all other emergencies. We waited for the disease to spill over into the human population. We identified it, sequenced it before proceeding to implement control measures. This happened with the coronavirus, COVID-19. It happened in early January. By February, when China took punitive measures, the whole world was still watching. And of course, when it spilled over to the other parts of the world, control measures failed. And why did this fail? It failed because of inadequate information, lack of information. And why was this so? Because even though we had sufficient information about coronaviruses, we had sufficient advisories about coronaviruses, most systems were not talking to each other. There was no intersectoral collaborations, as Steve mentioned. So what was missing and what is still missing in this COVID-19 case? The One Health concept. The One Health, as put forward by the tripartite initiative of composed of the OIE, WHO, and the FAO, is the collaborative efforts of multiple disciplines working together to attain optimal health for people, animals, and the environment. One Health involves the integration of 3 health systems, which are often considered very independent: the human health, the animal health, and the environment. In order to effectively control zoonotic diseases such as the COVID-19, efforts must be directed at these 3 systems: the evolution of the disease in wildlife, the human-animal interface occasioned by the close contact in the environment, and the infection and spread of the disease in humans. The veterinarians, the human medics, environmental epidemiologists and ecologists must work together to determine how disease processes in animals can interact with environmental risk factors to impact human health. They need to determine appropriate risk mitigation measures required to break the chain of events that will result in disease outbreak for any zoonosis. There is need for collaborations between these three systems for effective monitoring and control. Let me just highlight the three systems. The animal health system, which mainly is controlled by veterinarians. Within this system, there is a need to maintain adequate and continuous surveillance in animals, especially in the global hotspots. This will ensure that adequate monitoring of the evolution of the organisms that are considered potential threats to humans is done. This will also ensure that the spillage of disease into human population is prevented, and this could be done either by vaccination or mass culling. Now, most importantly, while this is being done, adequate information must be shared between the veterinarians and the medics on potential threats to human population. Now, coming to the human-animal interface, these involve all parties. And here, we need to develop capacity and promote practical evidence-based and cost-effective tools for zoonosis prevention. We need to have appropriate surveillance for detection of any potential threat. We need to report and effectively communicate these threats to relevant authorities and people concerned. Epidemiological and laboratory investigations should be carried out by both veterinarians and medics, including ecologists, to determine risk and how to manage them. And in doing all this, information and support should be given to countries that are considered a threat to this. Now, on the human interface, of course, the humans mainly. On the human-animal interface still, well, just to mention a little about wildlife trade. Of course, we've heard from what Steve said, most outbreaks are linked to trade and consumption of wildlife products. In such a situation, appropriate risk assessment to determine the risks associated with wildlife contact, use, and trade should be done. Implement best practice and global standards, especially for trade. With the COVID-19 situation now, there is need to develop better standards for management of situation related to trade now, not only for the traders, but also for animal handlers, for consumption, for cultural practices. These standards should be translated into policies and legislation so that they will form regulations that will be implemented across board. Now, in the human health system, there is need to put in place early detection systems, and this involves laboratory support for early detection. Now, particularly related to these COVID-19 cases, we have little or no capacities in most areas for testing and for detection of this disease. But I'm aware, like most other people, that veterinary laboratories across the globe are well capacitated, particularly in Africa. We have many countries with high security labs, BSL 3 and BSL 4, which could be used for the diagnosis of COVID-19 or any other disease emergencies. These particular laboratories should be put to support the control efforts by supporting the laboratory diagnosis for early detection, contact tracing, and isolation of confirmed cases. And most especially, there is need to effectively communicate and educate the populace about what is going on. In Africa, the major issue here is lack of information or misinformation. We're getting different information from different sources about the disease prevalence, about treatment, about testing, about all issues surrounding the case, which shouldn't be the issue. Finally, there's need for the development and use of vaccines and diagnostic reagents. Now, vaccines represent the best measures to control diseases, especially vaccine-preventable diseases. Now, laboratories with capacities to manage viruses, especially the COVID-19, should be capacitated to carry out research and the development of vaccines and diagnostic reagents. Now, with the misgivings, suspicions, and misinformation about vaccines, there is a need to establish platforms for vaccine development. The COVID-19 is an unusual situation which demands an unusual response. We need to put away the usual competition associated with vaccine development and to make vaccines developed under pandemic situations as public goods. Now, this will enable experts to contribute transparently and to work to make sure that effective, affordable, accessible vaccines are produced in situations such as this. Now, data on vaccines developed against COVID-19, for example, must be peer-reviewed and published. We have a lot of people coming out to say they've tested this vaccine, is not working, or the other is killing people. Vaccine quality testing should be done in competent laboratories all over the world. Now, when a vaccine is developed, it should be shared to laboratories, competent laboratories to test, and these results from this made available to all people. Representatives from different regions and of the world should be involved in the assessment of vaccines, especially representatives from regulatory authorities. Now, COVID-19 is a wake-up call for all. A lot of things have happened. We have witnessed our shortcomings, but governments need to consider the establishment of multi-agency, multidisciplinary task forces to ensure shared objectives, clear rules, effective information sharing, close collaboration in all the systems as part of the one government, one approach to implementing the One Health system. Now, COVID-19 is a clear indication of the fundamental interconnectedness of humans, animals, and their shared environment. A shared and collaborative approach is required and is the key to the healthy and sustainable control of this disease and all other global emergencies in the future. Thank you. This is where I stop with my contributions. I look forward to other contributions. Thank you.
Thank you, Nick, for your interventions. And we appreciate the fact that you also brought in the issues of vaccines. And vaccines, when it comes to Africa, they actually raise a number of concerns. Apart from issues of access as well as affordability, there are also issues related to, of course, risks, from previous experiences. So it's actually a quite sensitive area. But the issue of One Health, of course, it's also highly, important. in the sense that we need to provide a platform whereby different stakeholders within the health system could be able to make a contribution. And of course, the issues that you raised initially of information not shared, and the fact that people have been aware of some different strains of coronavirus before. I mean, that's something that we can learn from, so that at least in future, governments and everybody involved, of course, will be ready. And the issue of humans, the environment as well as animal health, all coming together under the umbrella of One Health. Of course, that's actually one of the policy recommendations that we can be able to leave this conference with. Let me invite Scott Newman, Dr. Scott Newman, to make his introduction. Thank you.
Okay, thank you very much, Harson. Can you give me control of the screen so I can show some slides while I present?
Sure.
Yes, no problem, Scott.
Our colleagues behind the scene who will enable that.
Okay, can you see my slides?
Yes, it just needs going to full. There we go, yeah.
Yeah. Okay, great. Well, I'm really happy to be part of this AU Traffic convened event on behalf of FAO. And today, I think the presentation will build largely upon what was already shared by Steve and Nick. And I'm going to focus a bit more on using One Health and actually value chain approaches in Africa to address some of the impacts of COVID-19. I think probably most of you realize that FAO is largely focusing on eliminating hunger, food insecurity, and poverty. And we really support a lot of work on making agriculture, forestry, and fisheries more sustainable and efficient, and also increasing resilience of livelihoods, particularly in the context of COVID-19. We have taken a slightly altered approach and really honing in on understanding and mitigating the pandemic effects on food and agriculture, on safeguarding food security and livelihoods, particularly of those who are most vulnerable, on understanding the virus's origin and spread. And then finally, one of the key focuses of our COVID work is on really looking at a unified One Health approach, balancing human, wildlife, livestock, ecosystem interface, and food safety issues.
Hey, Scott, sorry, is it possible just to check which screen you're sharing? Because at the moment, it's not full screen.
Okay, let me try to see if I can reset the full.
We can see the PowerPoint, but it's, yeah, it's still in display mode. So if you go to the top, it says display settings.
How about now?
Perfect. That looks great. Thank you.
Okay. Okay, it's good for you? Yes, okay, great.
Sorry, it's just reverted back. It was okay, and then when you went to presenter view, it reverted back on the screen. So
okay.
the notes.
All right. So I will. I'll just continue. I think that what we can recognize is that this was initially seen as a major health crisis, but now what we're really seeing is that there's significant impacts on livelihoods and also on food and nutrition security. And we also know that farmers and agricultural value chains have been impacted at many different levels, farms along the value chains, even at markets. And we're really struggling with this being a broader issue to address. And so this is at the heart of the big challenge that we face. Now, What do we know about the role of wildlife? Well, I think the earliest infected person had no reported link with this market in China, and we know that only about 28 of the 41 cases had a direct link to the market. So while the best information available suggests that we're really looking at this being a pandemic associated with a spillover, and there's a lot of focus on the market, I think we have to look even beyond the market to try to understand how other exposure may have taken place even prior to people coming to the market. And you know, that's not to underemphasize the fact that we obviously had a lot of different species reported at the market. So this is a complex situation, and we're really still investigating and trying to understand what is going on. What do we know about COVID-19 in animals? Well, so far, all of the human cases have been human-to-human transmitted, and we don't have the evidence yet to demonstrate the way that the virus may have spilled over to people, but we certainly have done, and there's been work on other animals looking at whether other animals can be infected. And we know that domestic cats, tigers, lions, ferrets, mink, all are susceptible and can have clinical signs. Other animals like dogs have tested positive but don't get clinical signs per se. And then other groups of animals, the ones listed here, the pigs, chickens, fin fish, shrimp, crab, oyster, mussels, don't seem to be susceptible. And so we're still, you know, literally as we're talking today, learning more and more every day. And so this is a snapshot of what we know today. But obviously, we continue to get more information, and we'll continue to update. But I think what's important to realize is that so far, the human cases that we are cognizant of, all the evidence suggests that it's human to human, and that there may have been an initial spillover event that started this whole event. Now, when we look at zoonotic diseases in general, I think you heard that a majority of emerging infectious diseases in people are zoonotic, means they come from animals and go into people. Of those diseases, about 60% have wildlife reservoirs, meaning they've come from wildlife originally, and then they've gotten into people. Now, what's important to realize is that sometimes they're directly spilled over from wildlife to people. In other cases, they use other host species. For example, they may go from wildlife to livestock to people, which, you know, in the case of Nipah, we know we have a bats, pigs to people, and so forth. So we need to think about this in that context. But the important thing is that there are three main ways that people are getting exposed. One is through close contact with animals. The second is through vectors, meaning insects primarily, that are biting people after they've bitten infected animals. And the last is through food safety type issues, so contaminated food or water. If we take a look at, again, some of the historic diseases, you can see that I've got a bat next to the ones that have a potential wildlife reservoir versus others that have come from livestock. And so what we can see is that it's a combination of both wildlife and livestock transmission dynamics that are contributing. And you know, you can look at the comparison of the year and the cases and the deaths, fatality rates, etc. I'm not going to go into the details, but the one point I do want to make at this juncture is that, you know, we keep having these events. This keeps happening. This is not a one-off, and we can pretty confidently say that there will be more to come. And what is concerning, most concerning about this situation is that we believe there are a lot of drivers of these events. And what we're starting to see is that the frequency is continuing and potentially increasing. The impacts of these events are also very significant and again increasing if we're using COVID-19 as our place mark to think about this. Now, COVID-19 and food safety, this is really an important issue for us to understand. And currently there's no evidence that the coronavirus is causing any transmission into people through food. And so we as FAO and others are really supporting good general hygiene habits, the washing hands story, and of course, before handling food, during preparation, after handling, before eating. But also, we need to ensure that all food and meat is thoroughly cooked and all food preparation equipment and surfaces are washed and sanitized. So I think it's important to say that, there are no new food safety measures that are in place because of COVID-19, but it's about raising awareness and implementing good safety and hygiene practices. And I think, along the lines of the linkages to wildlife and issues related to wildlife, it's important to highlight that people should not be handling, slaughtering, selling, or preparing, consuming meat that originates from sick either wild animals or even livestock for that matter, or animals that have died of unknown causes. And then there's obviously guidance that's been developed through FAO and WHO. There's some that's been developed for food safety authorities, but broadly speaking, that the international standards that are out there developed by Codex Alimentarius Commission, and particularly the food hygiene and import and export inspection certification, this lays out the opportunity for us to ensure and maintain access to safe food at a global level. And I think that this is important for us to refer to. Now, when we talk about zoonotic diseases and spillover, I think it's important to realize what One Health is. And just for the sake of explaining this for a moment, I think that what we need to understand is that there are several sectors, whether it's wildlife, livestock, or people, but we all live in the same ecological system. We share water, we share air, we share land, we share food, soil, etc. So the point is that if one component of the system is not healthy, it will affect the other parts of the system. And I think that when we look at One Health in a simple way, it's basically a collaborative effort of multiple disciplines working either locally, nationally, regionally, or globally to promote and ensure the health of people, livestock, wildlife, and in the environment. And I think one point that I want to make here is that, we have a bit of a challenge because we have a medical community that's leading a lot of the One Health work. And we have an environment, an ecology, and biology community that needs to be part of the discussion. These two groups have changed, they've been trained in different ways. And so the challenge that we face is having communication across the two sectors. And I would say that environment actually should be expanded to include biodiversity and ecosystem services. So when we get to solutions, and now I'm gonna go through a couple solutions and the way forward, I think, based on this introduction. I think that we need to ensure that food system transformation includes and accommodates for wildlife issues. We know that we have a lot of people who rely on wildlife, local communities who are dependent. That's their source of food and nutrition. We need to make sure it's sustainably done. We also maybe can identify alternative culturally acceptable protein sources. We have to increase awareness of local communities about these zoonotic diseases, and then also support capacity development to improve food safety and hygiene for local communities, but also for the people that work with them, whether it be animal health workers who support wildlife or even livestock-related areas of work. The second solution that I think is an opportunity for us in lieu of COVID is to really think about food safety across Africa. And this means in raising awareness for all the actors along the food value chains, from farm all the way to fork, and talking about foodborne pathogens and zoonotic diseases. Supporting capacity development for all of these food chain actors, improving food hygiene and food safety, and then supporting infrastructure and capacity development for government authorities to take this on, and particularly We know we need to target additionally food stalls, open markets, informal markets. These are all sources of food for millions of people here in Africa. And so it's not just shopping at supermarkets, but it's looking at where the majority of people are getting food and making them safe and up to standards. These are opportunities for us to consider. And then improving diagnostic capacity to deal with food safety issues. And I think that, wildlife farming is another area where there are some great cases of excellent, well done wildlife farming. And there are other cases where it's more an informal sector and perhaps not meeting the standards that we would like to see in lieu of potential risks and targeting risk assessment and targeting response to risk. As was alluded to by I believe, Nick. The third opportunity I see is that we better engage the ministries of forestry, wildlife, and natural resource management to deliver One Health. I'm very cognizant of all the great work that's been done on One Health. Up to date, FAO is one of the global leaders. We're part of the tripartite that was mentioned. We have an official agreement at headquarters level with WHO and OIE to continue One Health work. But where I see the opportunity is to better engage the ministries of forestry, wildlife, natural resource management to be an equal partner at the table with the ministries of health and ministries of agriculture and livestock. And I think this can be done at 3 different levels, both global, Africa, and country level. Particularly at the Africa level, I want to just mention that there is an Africa Tripartite One Health Regional Coordination Group that was established already. And there is also a lot of work, I know, at the African Union already in the context of One Health, already some great progress on antimicrobial resistance, and hopefully this type of Africa-wide, AU-wide coordination to look at zoonotic diseases and preventing spillover events can be an expansion of some of that work. FAO has been working through the Africa Forestry and Wildlife Commission, and some of the important areas of advancement is most recently there was a commission meeting that took place, and there's a recommendation on establishing a working group that really would help us drive forward some of these ideas of dealing with One Health, having a representative from all of the member countries to the commission. Nora Berhoumi, who is on the call, is the secretariat, and I will invite her to speak at the very end to provide any additional information about the commission. But I think that this is already an opportunity because it primarily prioritizes these sectors, this part of the sector that's not contributing to One Health to the greatest extent possible. And I think when we look at emergence and drivers of disease emergence, this is where the opportunity lies. And then country level work. Obviously, there's a lot of One Health platforms, steering committees, policies, and action plans. But again, the question is the Ministry of Forestry or those responsible for natural resource management at the table? And if they're at the table, are the issues that they're prioritizing being considered in One Health action plans and moving forward in One Health? I think these are lots of opportunities. I just will mention that FAO will make this available, had a multi-sectoral dialogue. We brought together the ministries from 11 countries to focus on this and to try to, again, raise the profile and orient the discussions around not just the animal health and public health issues, but to also bring forward those priority issues of the resource managers. And I think that everyone agreed that One Health is the way to go. There were some areas of work that were clearly identified, and then obviously the fact that this contributes. This contributes to significantly delivering the SDGs and Malabo commitments. So I think it's in line with where we want to go and what we want to do. Expansion of One Health has to really look at the drivers, I believe, of emerging infectious diseases. And the yellow here are the main drivers that much of the research has pointed us to, and the solutions are in white. Halting deforestation and biodiversity loss, habitat loss, addressing illegal trade, sustainable management of resources. Sustainable agricultural practices need to be enhanced, climate smart agroecological approaches, and then also thinking about community-based solutions for some of the issues, because we know culture and tradition are very rich. We're not saying that we need to change them per se. In some cases, they're very appropriate. In other cases, we need to try to find complementary alternatives and solutions. And I think that there's also room for some of the international treaties and mechanisms and enforcement to support other elements of dealing with some of the challenges that we face. I will skip this because I think I've covered this, but I think what you can see is that contact rates are the challenge. Human-wildlife contacts, particularly over some of the bushmeat, wildlife consumption, extractive industry, and exotic pets. These have all been highlighted as some of the drivers of disease emergence. And so these need to be addressed in the One Health approach going forward. Just about finished here. The last solution that we wanted to put forward, and this is a little bit tangential but very significant to the natural resource management issue, is trying to look at developing capacity to target preventing diseases from impacting wildlife populations and biodiversity. We already understand that we have a lot of endangered and threatened species, and these are just a few examples of diseases that, once they spill over into wildlife populations, can create very significant and sometimes extinction level impacts to wildlife populations. I don't think we're dealing with this either at the right level from the context of One Health and disease prevention and control. So I think this is another opportunity. So in closing, I want to thank you for the opportunity to present on behalf of FAO. There's an additional One Health video presentation that was made at the Africa Forestry and Wildlife Commission. The link is here. And then Nora has provided us also with the link for the AFWC Commission session. And I just want to ask her if there's anything additional that Nora would like to add to this as she supported the preparation of the presentation as well. Thank you very much.
Thank you very much, Scott. Maybe just one point to add to this presentation that is really linking the diseases, the One Health approach, really integrating the forestry and wildlife and natural resources managers and those ministries that are in charge. I think certainly the importance of having these drivers, addressed so that we can also avoid and prevent further pandemics, or, as the one that we are, let's say, living today currently with COVID-19. And maybe one other point that, of course, because of the interest of time, that have not been touched, is also looking, the impacts of COVID-19 and also for the illegal trade is also the issue, for instance, that we in Africa now, I think we are challenged, and certainly park managers and biodiversity managers and forest managers are challenged regarding, because there is no travels, so there are no tourism, coming to Africa. So this would mean that maybe this would actually expand the poaching and the illegal, let's say, trade of, forest and wildlife products, which are, wildlife, which is really a big issue, and I think needs really a very important attention from not only the ministries of forestry and wildlife and tourism, but actually from the government point of view, and maybe at the regional level, at the AU and AUC level, who will be supporting really such, to address actually these issues and bring maybe incentives for continuing monitoring, controlling, and sustainably managing the resources, whether they are forest or wildlife, in the rich biodiversity of Africa's soil. So thank you so much for giving me the opportunity to add this point. Thanks.
Thank you, Scott and Nora, for reminding us about the mandate of FAO. Of course, we all need food, so for that reason, we value FAO. And we are actually much more informed in terms of the origin of the coronavirus. And of course, we have noted the fact that there's no direct link between the market as well as the virus. How it emanated from there, that evidence is not yet well documented by research. And of course, it's important that we don't take or adopt a simplistic approach, but rather we keep our minds open and be able to extend our investigation beyond the market itself. And of course, you also highlighted the fact that there are risks associated with the modification of the natural environment, those associated with the agriculture practices, and some even associated with the cultures, in Africa, because we even find people who eat raw meat even during these difficult times. So basically, the issues of coming up with acceptable sources of protein that are acceptable from a cultural point of view, I think it's quite important. And of course, of late, with the outbreak of the locusts, some people have been actually praising that there's an opportunity, at least for us to access sources of protein. So basically, there are a lot of recommendations that you have made, and most of them are also pointing up to the One World approach, One Health approach, which is actually quite important. Issues of food safety and hygiene, and those, of course, are all issues that are quite relevant to the continent. And AU is also actually trying to make a contribution in that regard. So now, we are moving to the last speaker, and I think you will agree with me and commend the African Union Commission for being the only institution that has put forward a woman, in the spirit of gender equity. So on that note, allow me to invite Leah to take the floor.
Thank you, moderator. And my name is Leah from the Department of Rural Economy and Agriculture, and I'm going to discuss how the African Union strategy could be used to address some of the COVID challenges. I have a PowerPoint to share, so I'll try and get that done. Just give me a minute. James, could you allow me access?
Yes, you should be able to just share your screen.
I hope it's visible.
That looks great.
Okay, great. So we have the African Union Wildlife Strategy, which was endorsed in June 2015. And one of its aims is to foster common and coordinated response by countries in the, coordinated by countries in the continent to combat the illegal exploitation and trade in wild fauna and flora. And another aim is to promote a strong national, regional, and international response towards safeguarding all wild fauna and flora in Africa. The strategy has 7 strategic components, and I'm going to try and show how these strategic components could provide a continent-wide, multi-agency, multidisciplinary response to the challenges of the impacts of COVID-19. Actually, this is the title of my presentation. So we have the 7 strategic components, and the first one is political commitment. And under this commitment, we have several areas of activity. And one of them is, for example, to encourage membership and ratification of and domestication of effective implementation and international agreements to conservation and enforcement. Such these include conventions such as the CITES, the Maputo and LATUF, and what the key partners which we have identified in this include, of course, the AU member states, the Commission, UN agencies such as UNDP, UNEP, UNODC, and but the key ones on this political commitment are the member states. In light of this COVID-19, we've seen a lot of political will to come up with the solutions and also to stop the spread of the virus and also to find some solutions to the current impacts. And without the political commitment, it would not go so far. And so far, we've seen a lot of that. And we'll try to see how to better strengthen the political commitment on this. On the second area of intervention, we have the regional and international cooperation. And the areas of activities under this strategic component include enhancing cooperation amongst source, transit, and destination countries. We're also calling for collective engagement, regional legislations, etc. And the key partners and actors in this area include, of course, the regional economic communities, institutions such as the Interpol, IQIC, the Customs Union, etc. We also have NGOs in this category, and yeah, the NGOs and conservation NGOs. Under the enforcement and compliance, we have issues on compliance with policies, legislation and regulations and judicial institutions. Again, this, without the proper enforcement, we are not able to track the illegal trade in wildlife and reduce it, because just like the illegal wildlife trade and just like wildlife and these zoonotic diseases, they are transboundary in nature, so they move from country to country, are not confined to one area. And now with the maybe coming up of ideas such as closing markets, etc., wildlife markets, this trade, as one of the presenters mentioned, might go underground, which means there will be more of this illegal trade, and this would be a source of would create more chances for the spread of zoonotic diseases. Under the strategy, we also have issues of training and capacity development, and this is issue where we have strengthening the capacity of existing institutions in Africa. For example, now we have the Africa CDC, which is up and running. We also have centers such as the AU PANVAC. We had the director speaking earlier on. They have put a lot of effort to strengthen that particular center, and they are currently even carrying out tests for the COVID-19. There's also training of local communities, where communities that are, the capacity of communities is built so they're better able to live with wildlife and also to benefit from some of the resources that come from wildlife. The partners in this, for example, we have institutions such as IUCN, which are leading on the local communities angle. We have also the local governments and conservation NGOs around the protected areas working on this. We have the advocacy and awareness, and this is mainly for targeted groups and communication, education and awareness. Under the advocacy and awareness, in the light of COVID-19, of course, most people would not know how to handle wildlife and the safety precautions that need to be taken. And so with a targeted approach and targeting the specific groups which are closest to wildlife and those involved in the trade and the transport and the storage of these animals, these are some of the areas that could be reached. Again, here there's a multitude of partners working in that area. On the knowledge, information, and technology, this involves mainly the research on monitoring system, databases, sharing of existing ones, Again, all this is aimed at combating illegal exploitation and illegal trade in wild fauna and flora. And the research would be on the new systems, but also we have existing ones such as the MIC system that countries could work to better use, and monitoring of wildlife, of course, is key if you are going to prevent future outbreaks of zoonotic diseases. Or rather to even better cope with them, because we are for sure going to experience more incidences like this. On the issues of governance, we have inclusive governance for wildlife resources, and this again is involving the local communities, indigenous peoples, resource management, etc. And under each of these categories, we have listed a wide range of partners and actors who implement their different, they play their different mandates and roles based on their competencies and outreach, if we call it that. The next slide, we just try to compare some of the other existing strategies which are existing on the continent or outside the continent as well, to see if some of the activities that are proposed as areas of intervention under the African Union strategy are in line with others. And so we looked at the East African Community Strategy, the ECOWAS strategy, the European Union one, the IGAD strategy, as well as the US strategy. And you can see most of the characteristics are feature across the different strategies. So this was just an exercise which was conducted to do a mapping before the indicators for the implementation of strategy were developed. And some of the lessons that we picked up from this COVID experience, we picked up the issue of the interconnectivity of between nature and the society. We've seen the big impacts which have been, the big impacts on the economy. Borders have been shut down, there's low tourism, and of course, we always thought nature existed by itself and then the humans on one side. But I think we've learned now that both have to be balanced, and that's where the One Health approach comes in, where we have the nature, the society, and the wildlife together addressed as one. We've seen the need for strong institutions, in particular public institutions, and I think it's very important to see how these public institutions can be well financed and given the independence they need to be able to advise the public using science, as opposed to having the political responses where which are not necessarily based on science. So the independence of such institutions also is key, because they should be able to give authoritative advice based on credible the background science. We have existing institutions which are maybe implementing part of their mandate and not to the full extent, but they could be strengthened to see how they could cope with the future pandemics. I'm looking here at institutions such as CITES, which address just part of the wildlife trade without the health approach, or see how that can be mixed into one body that can deal with both the health issues and the human health issues and the animal health issues. And then we've also learned that there's need for resilient, sustainable systems, especially wildlife tourism sector. Most of the resources which come from tourism are the ones that go to conservation efforts in some of these parks. Now with the COVID-19, of course, we are seeing rangers being laid off. Some of the rangers don't have the protective gear needed, and that could affect the conservation of of the wildlife in this conservation of wildlife in these areas. Again, with the economic down with the negative impacts on the economies, the communities would, of course, turn immediately to the nearest sources of resources, which is the protected areas, and the first source of income or resources will be the natural environment, which is close to the communities living by. The AU has developed a policy brief on forestry and the impact of COVID-19, and our colleagues will be happy to share that after. And it addresses some of these challenges that the COVID is already having on some of the forestry resources, for example. There's also the need for alternative livelihoods, especially for these communities living around the protected areas and those that depend directly on the wildlife sector for tourism, as most of their livelihoods are now destroyed, as much as the others, of course, but in particular these ones in relation to this subject. We've also learned that collective action is possible at the global, national, and even at individual level. There has been unprecedented response by governments across the world to take collective action on a common problem. And not only the governments are acting, we have private individuals also taking action to take care of their health. People are not waiting to be forced by governments to wear the masks or to do the social distancing. So collective action is there if there is a belief on to solve a common problem. On the issue of resources, we also have now learned that the resources are there by governments, especially most of the time the sectors are struggling. For example, the conservation areas, the climate change, for example, all these environmental sector challenges, we face funding challenges, and there has been a belief that there is no funding for such initiatives. But now we've seen the unprecedented response by governments with huge amounts of funding to back up the economies and support wherever possible. So we've learned that when there's a political will and when everyone takes action, it is possible to respond to some of the global challenges and to address some of the environmental problems that we face now and in this wildlife sector and also in others. So this is basically it. And in conclusion, yes, we do need a continent-wide, multi-agency and multidisciplinary response to the challenges of the impacts of COVID-19 on wildlife trade. Through those, we have seen we have enough partners and institutions, different government agencies, and they all should work together to find a common ground and a common working space. Thank you, Mr. Moderator.
Thank you, Leah, for your interventions. You have clearly demonstrated the link or the threat that is actually emanating from COVID-19 when it comes to the overall objective of the AU strategy on combating illegal exploitation and trade of wild fauna and flora. And of course, issues that you highlighted that actually affect communities are quite important. Issues that relate to measures that are possible in terms of making sure that the implementation of the strategy carries on despite the threats that are actually emanating from COVID-19 are important. And the fact that the strategy adopts a coordinated approach that involves communities, governments, regional and international organizations, I think it's actually an important vehicle to making sure that we actually reach the objective. And of course, given the fact that people have been under lockdown, some of them, especially those who are involved in the trade of world fauna and flora, they feel that the market has actually failed them, in the sense that now probably the demand is higher than the supply, so that is also likely to affect prices. But apart from that, of course, it means that when the situation is back to normal, there are likely to be more incidences of illegal exploitation. We have got very limited time left, and just to remind you that this webinar is being recorded, so if you ask a question, you should expect to be recorded. So I think the best approach now is that I would actually take maybe just 2 questions from member states. If there are 2 AU member states who want to raise questions, they can raise that, and then I'll not intervene. The floor will be open to the panelists for them to react to the questions that have been sent in advance, or to react to the questions that have been put forward by 2 countries. And so I'm waiting for 2 countries who have got questions. Okay, in the interest of time, I will start with Steve. Stephen, if you have got a question that you wanted to answer to, and then in that sequence followed by Nick, and then Newman and Leah, and that should be 1 minute each. You have the floor, Stephen.
Okay, thank you very much. So I like the other speakers. I know I've been monitoring the chat bar, and I'll just pick up a couple of things from there. And remember, I've only got 1 minute, so but very good presentations, very interesting to hear the other perspectives. But I just wanted to note 2 things, and again, thinking as a wildlife trade specialist on what can be done on that side of things, is firstly at the national level. There's a lot of wildlife trade controls at the moment are very focused on the import-export business. There may then be conservation controls that relate to access and things like that. But there's often, particularly in the consumer countries, not great integration between those approaches. So it may be legal to, it may be illegal in some cases to import certain goods, certain wildlife species, for example, but then legal to have them on the market. So this sort of coherence between wildlife trade controls and then also that integration across to health and public safety controls. I think a few people have asked about that integration. Could say a lot more about that, but I'll leave it there. Just on the international, I think there's no doubt if more countries adopt national level controls for health protection around wildlife trade, there will be need for some sort of harmonization in the same way CITES originally tried to do on wildlife trade controls for conservation. That's difficult because it's not the mandate of CITES to do that, but there are some things I think needs to look between international institutions about some creative solutions around bringing these different interest areas together. And then just making regulation work. There was a question about financial intelligence units, I noticed, and about enforcement. And these basic approaches, which are still only getting up to strength at the moment and beginning to have impact on illegal wildlife trade, could have a massive impact in this area as well. So absolutely, these are important strategies when it comes to any health-related controls as well. I'll leave it there. Thank you very much.
Thank you. Before another person comes in, we have got a question from Ahmed Osman from Somalia. Please, you have the floor.
Good evening, all of you. I would like to thank the organizers of this important meeting. Also, I would like to thank the speakers and their good presentation. My question is, the coronavirus was having a very, very large impact for the wildlife of Somalia. If it's on the side of health, if it's the protection. For instance, the criminals has already increased their ordinary routine of work. So we need to be given an assistance for the rangers to protect the wildlife. And if that's possible, it will be okay. Another thing I want to benefit from here is, I want to ask, the FAO representative, please differentiate wildlife and forestry, which two different in Somalia. We didn't get any response whenever we need to contact with you. If it's possible, please contact us as a wildlife. As well as I want to consult Berhuni, which from Forestry and Wildlife representative. Please also differentiate wildlife and forestry, which two different. Nice, and thank you, all of you. And I want to say thank you for this important meeting.
Thanks, Ahmed. Can we get Nick, 1 minute or seconds?
Yes, my question is, the problem of Somalia and the side of wildlife is the lack of protection. Where there is no rangers, there's no protection. So what we need is an assistance from the rangers. And thank you.
Thank you very much. We heard you. Nick, can you come in for a few seconds, followed by Scott and Leah, please?
Can you hear me? Okay. Thank you for the time. There's no much question for me from what has been presented so far, but I just want to make a point. From the presentation so far, it is quite interesting to note the elaborate work done on One Health. You can see from Steve's presentation that we have quite a number of initiatives that have been put forward. But in my presentation, I tried to avoid that because from what we have seen with the COVID-19, One Health process or One Health system globally and particularly in Africa has failed. Now, the reason being, we have most of these initiatives, but they are still packed in communiques, in meetings, in recommendations. What we need now is to actualize it in the field. I will give you an example here. In Africa, we have over 30 labs currently that possess capacity to carry out research or to carry out diagnosis of the COVID-19. But these are veterinary laboratories. They are not allowed to do that. In most cases, where only a very few countries collaborate with these vet labs to provide these services, you find that these labs are left to waste because of inertia from certain sectors. Leah has mentioned that we now have the political will. It's left for the professionals now to agree. The whole world is tending towards global convergence. We need to agree to work together, to have specific rules, to agree, to allow all the parties participate. I will give you an example. PANVA here has the capacity to test for the COVID-19. Not only do we have the capacity, we have one of the best labs in Africa, that I can assure you. However, it took a lot of efforts to even bring this to the attention of people concerned to say, okay, we could do this. Quite commendable. Some countries are doing that. Ethiopia has commissioned about 3 or 4 of its veterinary labs to support. Nigeria has done the same. Uganda has done the same. Now, if we do this throughout Africa, this will support testing. I often hear, frustratingly, that Africa lacks capacity. What capacity?
You have gone beyond your time. Please, we'll appreciate it if you're able.
So, to say that the One Health concept need to be actualized. It need to come to the ground. We need to leave the meeting rooms and actualize them. Thank you.
Appreciate it. Scott.
Yeah, thanks for the final opportunity to give a few points. I guess I agree with what Nick is saying in that we do need to get further implementation of One Health. It needs to be more practical. It needs to be, in fact, out of meeting rooms and in the field and in the countries and at local level. I think that just picking up on 2 or 3 points I saw in the chats. First, the comment about which ministry is the right ministry to liaise with. I think there are some nuances across the different countries on the structure. And so I would say that, you know, we don't want to say it's just Ministry of Forestry, it's just Ministry of Wildlife, it's just Ministry of Agriculture. What we want to do is be inclusive of all who are involved in natural resource management, as well as disease prevention and control, which is public health and animal health. The second point I want to pick up on, there was a point about whether the finance ministry or those involved in financing are important. The answer is yes, because we keep identifying the need for doing upstream work, preventing disease emergence, dealing with implementation of One Health, and yet we can't rely solely on international investments to make this happen. If it's going to work, it needs to be a national commitment. The governments of each of the countries in Africa need to commit to making this work. It's going to work only when we get the full engagement of government. So to me, prioritization at country level and then investment in those priorities identified by that One Health Steering Committee or committee is important. The last point that I want to make related to this is drivers of disease emergence are really a little bit even upstream of surveillance and outbreak response. And we've had traditionally a challenge investing in prevention. But I think if any time is right, it's now because of COVID, because we see that the drivers are leading to major environmental concerns, it's raising awareness, it's proving the points that we've needed to get out in the open and discuss about what is causing this problem for us as society in a health context, in an economic context. Now is the opportunity to broach the subject on prevention. And prevention clearly is financially a better option than responding. And we can agree on that now at a global level. So I'll stop there. Thank you.
Thank you, Leah.
There was a question from Zambia on how do we mitigate the impacts of COVID on the ecotourism, which is funding most of the conservation efforts in the region. And I think for that, it would depend on the different countries. But I would say an emergency fund could be, you could look into the options with government on the emergency funds, which could be out there, or provide alternative solutions to the communities. I don't know. Right now, some countries have got support from development partners to pay for the rangers' salaries, for example. But of course, different countries will approach it in a different manner. There's a question on the youth, on how to tap onto the wide group, the large group of youth which are available to take action. And I think I would say youth are known as change makers. So we count on the youth to push some of the agenda for when the policymakers did not taking action fast enough. The youth could be used as to channel some of these queries. They have more energy, they're more vibrant, and have better technology at reaching each other and driving the agenda. The youth could also be active in the advocacy role, not just on the zoonotic issue, but also in general conservation. There's also the issue of youth unemployment, which of course could be negative in a way, as when the youth unemployed, of course, without proper structures to provide employment or activities, they could go into wildlife crime as well. So we would need to see how to work with the youth to maybe turn that energy that they have towards conservation efforts. I know some groups are doing a lot on the ground in relation to COVID and conservation. There was a question also on poaching and protein. I don't know if FAO would like to take that, but I've not seen so much, I've not seen any research lately linking the current pandemic to an increase in poaching for protein issues. I think that's it from this side. There was a question also on how is the AU able to provide support to reduce poaching, I mean poverty again, and so as to reduce poaching and pressures on natural resources. I guess this could be discussed in more general, but of course, reducing poverty is a key to many problems, including wildlife conservation and protection of the environment. Thank you.
Thank you, Leah. I would like to take this opportunity to thank all the presenters. You have actually demonstrated a clear link between COVID-19 and the socio-economic implications that are actually being noticed across the world. Impact on conservation, issues on, impact on health, as well as impact on the implementation of the AU strategy aimed at combating illegal exploitation of world fauna and flora, as well as the trade aspect of it. And you have also actually come out clearly with policy recommendations and strategies, including those of diagnostic nature and those related to strengthening surveillance. And I think all those have been taken into consideration by the audience. And moving forward, we are actually going to use the content of this webinar to come up with a policy brief that will be shared, and we'll also be able through traffic to make the recording of this webinar available to some of the people who may want it. So on that note, allow me to thank everybody for your participation, as well as the speakers and the organizers. I thank you.